Alright, so I'm washing my hands with alcohol-based gel. Alright, so this is washed. And then I'm putting on the gloves. Then I'm wiping my stethoscope. Sorry, I'm wiping my stethoscope. This is my stethoscope. I've wiped it. Okay. Then I'm checking the ID band of Paul. Okay, the name is Paul. Okay, good, I checked it. The ID band is checked. Now I'm introducing myself. Hello, I am Abbas. I'm your nurse, and I'm here to perform head, face, and eye assessment on you. Would you be comfortable?
Yeah.
Do you want to empty your bladder before we start the procedure?
No, thanks.
Okay. So after that, what I'll do is I have 5 questions, and these are just the questions. You don't have to respond to these questions because we have to just come up with these questions. You don't have to necessarily respond to it, but just listen to because we have to record these questions. My first question is your rash itchy? Do you have burning in your eyes? When was the first time you noticed this rash? Describe your headache. On a scale of 1 to 10, how would you rank your headache? Do you have any allergies? These are my 5 to 6 questions. Okay. After this, I'll be doing the physical appearance check on Paul. So physical appearance, I would check his age. So Paul's body, from Paul's body, it appears that seems to be 18 years old. Paul. His skin color is same all over his body. I can notice that, and I don't smell any body odor. So this is physical appearance. Now I will be checking the body structure. I can see that Paul's body is posture is upright. Um, um, Posture is upright. And Paul's body posture is upright. Okay. I don't see any obvious signs of physical deformities. His body is symmetrical. Paul, can you get up and then come to that wall so I can check your height, please? So now I will be checking the height of Paul. So, okay, so straight with the wall. So I can see that the Paul's height is approximately 170 centimeters. Okay, so Paul, we are 170 centimeters tall. Please come back and sit. All right. Now I will be checking the Paul's behavior. So I can notice that Paul is well dressed. Um, his personal hygiene appears to be good. Paul, look at me please. I can see that Paul is maintaining, when I'm talking to him, is maintaining eye contact. Um, Paul, what is that on the side?
Eyeglasses.
What is this, Paul?
Wristwatch.
Okay, how are you feeling today?
Good.
So I can notice that the Paul is communicating well. All right, so this is personal. This is behavior, Paul's behavior. Now I'll be checking the Paul's mobility. Paul, please get up. Take few steps forward and then come back and sit here, so I can check your mobility. Yeah, you can come back, please. Please have a seat. So while Paul was walking, I noticed that his walk was balanced and coordinated, and throughout the walk he was leaned forward. So I noticed that his walk was normal, and hence his gait is intact. Now I'll be checking Paul's breathing. Paul, can you breathe in and breathe out one time? Okay, relax now. I can see that Paul is calm. I don't see any signs of distress in his breathing. His breathing is normal. Now I'll be checking the level of consciousness in Paul. If I may ask you, what is your name?
Paul.
Paul?
Yeah.
What's your full name?
Paul Smith.
Okay. You know where you are sitting right now?
Yes, in the examining room.
Clinic,
Clinic, yeah.
examination room or clinic. Right, you're right. What time is it now?
Oh, it's getting late.
Okay. So Paul is fully conscious. I can see that because he responded to my questions completely. Um, After this, I will explain. So, Paul, I would have to do head and eye assessment on you.
Yeah.
Um, would you be feeling comfortable with that?
Sure.
Are you okay? I'll be touching you
Yeah,
in your head. Will you be okay?
Okay.
And do you want to empty your bladder before we start the procedure?
No, thanks.
Okay. So now I will be inspecting the head. I noticed that no lesions on the head. Now I'm palpating the head. So while palpating, I don't see any lesions, swelling, bumps, lumps in the head. Okay. Do you have any tenderness or pain in your head?
No.
No. So this was. So I just did the head examination. Now I'm going to be inspecting and palpating the hairs. So I noticed that Paul is blonde. The hairs are not evenly distributed all over the head. I don't see any lice or infestation in his head. Hairs. So no lice or infestation in his hairs. After this, I will be doing the uh, facial assessment. So I can see that Paul's face is symmetrical. I don't see any swelling on his face. The face color is same as that of the body. I don't see any scars, lesions on the face. Um, um, face overall is symmetrical. You can see. Um, I don't see any facial hairs except in the mustache. There are little here. No scars, no lesions on the face. I don't see Paul. You're sitting straight, right? So I don't see any involuntary movements in his face. No involuntary movements. No swelling. No scars. No lesions. Face color is same as that of the body. Okay, this was face examination. Now I will be doing the cranial nerve number 7 test, which is actually testing the facial symmetry. Paul, I'm going to be asking you questions or asking you to do something. You'll have to do that, okay? Um, can you lift up your eyebrows? Okay, look at the camera, please. Can you lift up the eyebrows? Good. Can you shut your eyes and then reopen them? Reopen, please. Okay. Can you puff out your cheeks? No, cheeks, sorry.
Oh, cheeks.
Yeah. I'm sorry, that was a little miscommunication. Anyways, can you puff out your cheeks? Cheeks. Cheeks. No, not teeth. Can you puff out your cheeks? Thank you. Can you show me a smile? Okay. Can you frown? Okay, good. Can you show me your teeth? Okay. So I noticed that whatever I was asking, except for one time there was a miscommunication, but the rest of that was all good. I noticed that Paul was following and he was acting the same way. So Paul's cranial nerve number 7 is intact, which means that facial symmetry is present. Now I will be checking his eyes. So I can see on inspection, I can see that the Paul, look at the camera, please. So I can see that Paul's eyes are symmetrical. Eyebrows are have blonde and black hairs on them. The hairs are evenly distributed, and the eyebrows are in line with each other. Eyelashes are well distributed. Eyelids are equal. Face color is same as that of the body. And all right. So Paul, can I check your eyes, please? Look up, please. Okay, good. So while Paul is looking up, I can see that uh, conjunctiva is pink and sclera is white. Okay, thank you very much, Paul. and I didn't see any discharges in the eyes. So this was my eye examination. Now I'll be doing the cranial nerve number 3 test, which is actually which is composed of 2 examinations. But before that, what I'll do is I have a pen light. I will check the size of his pupils first of all. So Paul, can you look toward the camera? So open your eyes, please. I can see. So I noticed that the size of the pupils is 4. Okay. Now what I'll do the Perler test. Perler test is pupil equally round and reactive to light in accommodation. So what I'll do is I'll shine the light in one eye and notice the size of the pupils both. Okay. So okay, good. Now I'll do the same thing from here also. Okay, so I noticed that the pupils in his eyes actually were reacting to the light before they were dilated, and after the light was shown they were constricted, both of them in both eyes. So his pupils have passed the Perler test. Now the second part of the cranial nerve number 3 examination is that's called cardinal gaze test. So in cardinal gaze testing, what I'll do is cardinal gaze position. What I'll do is I will ask Paul to follow my finger. Okay, Paul, can you not move your head and just follow my finger with your eyes? Okay. So my finger is 12 inches away from his eye. Okay, just follow my finger with your eyes. So I noticed that Paul was able to follow my fingers with his eyes only, without moving his head. So I can say that his cardinal gaze test or cardinal gaze position is intact. So using this Perler test and cardinal gaze test and pupil size test, I noticed that his pupils were round, equal, and reactive to light. So Perler test is satisfied, cardinal gaze position test is satisfied. It means cranial nerve number 3 is intact. So this was my examination. Paul, thank you very much for your coming.
Okay.
So examination is over now.